Coming up on the AXA Legislative Lunch Break, Edgar and I will get you all of your latest news and information from the state capitol and CDE with an in-depth analysis on how it impacts your school community. Today, we are talking about rainbow fentanyl, what you need to know about protecting students in your community, plus what the data shows about the growth of this opioid.
The AXA Legislative Lunch Break starts now.
And it's just after 1 o'clock. We welcome you on a Wednesday to the AXA Legislative Lunch Break, along with AXA's Executive Director, Dr. Edgar Zazwata. I'm Naj Alikhan, AXA's Senior Director of Marketing and Communications. Welcome. We're honored to have you with us. Go ahead and jump onto the chat today and say hello. Let us know what's happening in your region. Edgar, how are you?
Good, Naj. I'm happy. Another Wednesday. Happy to be here. An important topic today. So I'm excited that we're unfortunate that we have to be talking about it, but I think it's very, very timely. And then on top of that, just being energized, I've had the chance to travel to a couple of our regions at AXA, hearing from our members is definitely the best part. I think you would agree. It's the best part of our job, just getting to. And I joke that we often, you and I and other members of the team often get asked to go to give updates or to talk. Actually, my favorite part of the exercise is when we shut up, when we stop talking, and we actually get to hear and listen to our members. So I've got a chance to do that a few times in the last week. So that's been good. And I know we have some events. We have some of our governance meetings next week. I know we're going to promo one of our big conferences and PD opportunity here coming up. So busy season here, I know, in schools and also at AXA, but good stuff happening.
Yes, absolutely. Totally agree with you. Want to say hello to our friends over in Region 7. I had the opportunity to visit Region 7. Mark Campbell, who's one of our loyal viewers on here, he was there at the event. Scott Nanick, also one of our loyal viewers, was there as well. They brought me up to the town of Murphy's, Edgar, which I had never been to.
Beautiful.
Oh my gosh. Yeah. You know what? The next time we get a free weekend in the Alikhan house, I will certainly take a trip over there. Saying hello to Maria Thompson, Maria Russell, Gloria McKerney, Grant Bennett. You're from your neck of the woods, Grant. Good to see all of you. Before we get into our news headlines, I just want to show you, Edgar. So I came out of yesterday's cabinet meeting a little bit early. As you know, I had something that I needed to attend to. And as I was walking,
that's what you said. I don't know. That's going to be your story. I went along with it. So we'll stick to that. You had something going on.
Look, it's not often that I leave a cabinet meeting early. So I appreciate you giving me that moment to leave there. But as I was walking out, my staff came and said, "Hey, we got an early Boss's Day gift for you." I don't know when Boss's Day is, but this is what they got for us.
No.
Right here. Just the promo photos of the Legislative Lunch Break right here. So framed in my office, when I showed my daughter, my youngest daughter, my high school sophomore, that, she goes, "Oh, look, you and Edgar got your prom photos framed. Isn't that nice?"
It is, Naj, it is homecoming season here. I love that. I didn't know Boss's Day was coming up. So that, I guess that's an important thing to know.
Yeah.
And I love the humor from your staff there. Yes, the outtakes from our photo section, which I love the picture that just, we had to play it up, had to pretend I love the one where we look like we're actually serious. And I'm sure people have a lot of thoughts about us thinking that we were serious in that picture.
I know it. And now I feel like we're going to get some of our viewers to jump in here and say, "See, now you need to bring those as 8x10s and do a whole autograph session at Leadership Summit." If that's the case, we'll just leave it to you. Okay. I think that the members really care about
a cover for the next Leadership magazine. I love that. Hey, all kinds of great ideas there.
Michelle Eklund, our great communications leader over at Placer County Office of Education, notes that Boss's Day, October 16th, So we'll have to keep that in mind, Edgar. I'll have to figure out what exactly we're going to get you. Maybe I just hand this over to you and put this in your office.
Keeps on giving there.
Exactly. Let me do a couple of news headlines right now, and then we'll move on to our guests today and our main topic. As we know, legislative session ended. The governor had bills upon bills of which he could sign or he could veto. I want to make note of two of them. One, that the governor vetoed was the bill to expand school health clinics. This, according to our good friends over at EdSource. This is Assembly Bill 1940, which would have set aside $100 million to create an expanded healthcare clinics on school campuses. They would have been offering free medical and dental care, reproductive health care, and mental health services to not just students, but in some cases, the local community. I'm trying to figure out exactly who argued against it, but I did want to point out, Edgar, that school health care and on-campus clinics are part of the governor's Community Schools Initiative, which allows $3 billion to create community schools over the next 7 years. So there is already a program there. This would have seemingly put maybe a set aside that from that, which I think sometimes happens during the end of sessions. But anyway, that was one of the vetoes. But I will make mention of this, and I think this is something that is interesting to address as far as the teacher shortage is concerned, and that is the governor approving Assembly Bill 2295, which will loosen the current zoning requirements that will allow school districts to build affordable housing units for teachers and for staff on land that they already own, and they will not have to go and have it rezoned. Edgar, this is good news. This particular bill is good news for school districts when it comes to attracting teachers, educators into their districts, because we know affordable housing really is a challenge for some to enter education.
Yeah, I'll touch on the first bill that you mentioned just briefly first, Naj. Yeah, and I think you summarized it well. I mean, the governor has made the focus of wraparound services, community schools, bringing in healthcare centers into schools is obviously a priority. I don't know the exact veto message on that bill, but I know it is a sign of what the governor has done, even with some things that you would deem to be his priorities. Last week, we talked about him not approving a couple bills as related to full day kindergarten or to compulsory kindergarten. The governor, I mean, I have to say, is being a little bit more conservative. And I think this is one of the probably examples where, given some of the revenue projections that are coming in, that the large amounts of money simply not going to be there, it looks like. You know, not to say no one's talking about cuts or reductions at this point, but it is forcing the governor to be much more conservative about commitments moving forward. On the second bill, you're right. I mean, if there is one issue, is we've even before the pandemic, one of the biggest issues we were talking about was the educator shortage, and especially in certain communities, just housing, lack of housing, the price of housing has been an issue. There's been a lot of movement and talk on this whole notion of should there be more investment on housing specifically for educators, for teachers. And so I think this is one effort that you see the governor kind of moving in that direction. Yeah, and I would agree on a positive, and that is a positive development.
Well, and our good friend, our loyal viewer, Gary Reller over in Riverside Unified School District asks a valuable question about how can school districts afford to build housing and give raises that they are currently giving. I mean, it's a balance right now. Building this affordable housing on land that you already have. Well, having land is obviously one piece of that puzzle, but then of course there is the compensation for bringing in new teachers. It seems like there are a lot of variables here, Edgar, where the puzzle might fit together in one school community, but may not fit together in another, which really creates that difference.
Oh, I mean, I think it's a classic case of one size doesn't necessarily fit all. And if anything we learned here at AXA, just talking to the diverse set of members that we represent, it's just that sometimes these policy solutions that make sense in a particular community may not, given a number of factors in other places.
Yeah, absolutely. Let's move over to our main topic today. It was about a week and a half ago, maybe 2 weeks ago, Edgar, maybe you could actually clarify the date, that California Department of Public Health put out a notification to all of the schools, all of the districts statewide about the dangers of rainbow fentanyl and how we have seen more of this in our communities and how it is penetrating into our schools, and really providing some information, some educational opportunities, some data of which to really begin this discussion or continue this discussion in our school communities. And we have two experts in the field here with us today to talk about this. Robin Christensen is the Chief Substance and Addiction Prevention Branch at the California Department of Public Health, and Dr. Smita Maholtra is the Medical Director at the Los Angeles Unified School District. So honored to have both of you here on the show with us today. Robin, let me start. What do we know about rainbow fentanyl? What do we need to know in our school communities moving forward, especially since we're about a week and a half, 2 weeks since CDPH put that message out?
Yeah, so what we really want folks to think about when it comes to rainbow fentanyl is that it is a brightly colored fentanyl. It can be packaged like pills or looking like sidewalk chalk. But when it comes down to it, our lab testing across the nation has really shown that the drug itself is no different from fentanyl. It's brightly colored. It may be more visually appealing. But fentanyl itself is pretty scary. It's a drug that's 50 times as powerful as heroin, and a very small amount, just a few grams, is enough for somebody to overdose. So we know that fentanyl is in our drug supply because it's really cheap. It's pretty easy to manufacture and it's easy to transport. So there's also demand for it. This means that more expensive opioids and hard to get opioids, they are now being replaced with things like fentanyl. It also contaminates other drug supplies like cocaine and methamphetamine, even substances we might not expect it.
Dr. Maholtra, would you add anything to that?
Yeah, what I would add to that is, with Halloween around the corner, I really urge parents and even teachers to let parents know to check all the candy before children eat it, because like we showed, rainbow fentanyl looks just like candy, and to really start having those open and honest conversations with your kids now about not ingesting unknown substances or substances given by from others. I've already had the conversation with my 5-year-old. So it's never too early to start that conversation with your kids.
That's a great pragmatic piece of advice. As a father, we take it for granted, right? But scary times. I'm gonna follow that advice. Dr. Maholtra, so on that note, we know there's a lot of dangerous narcotics, and we talked about. I think you both kind of did a good job of summarizing what's unique here. From the district's perspective, I know the district been a lot of publicity. There's some cases here over the last number of weeks. What really caused the district to put a specific emphasis on this issue to the extent that it's putting out a strategic plan on how to combat this specific narcotic?
So you had touched on it a little bit. Our district has really been trying to recover from a devastating few weeks. On September 13th of this year, our very own student, Melanie Ramos, 15 years old, was found passed away on one of our school campuses from a fentanyl overdose. Her friend was also found suffering from an overdose nearby. They had purchased what they thought to be Percocet pills from a 15-year-old student at a neighboring campus, also an LAUSD school. And what this really tragedy showed us is that all of these students, really all of them, are victims to this growing crisis in our communities. And, recently the New York Times recently reported that there's been a tremendous rise in overdose deaths in the United States over the past year. But overall, the use of illicit drugs among adolescents is actually declining. So why this rise of overdose deaths? And that's due to the potency of fentanyl. So the DEA has informed us that the likelihood of illicit drugs being contaminated with fentanyl in Los Angeles County is now close to 100%. And so because of how deadly this can be, and the fact that this issue, which largely used to affect mostly adults, is now rapidly affecting children as well, and our children in our communities, that's why we knew we had to take action.
Let me ask let me ask about this plan, Dr. Maholtra, in LA Unified. Edgar mentioned a strategic plan that the district that you've helped lead has put together to address fentanyl. Considering that more than 60% of the districts in this state are rural districts, can you talk a little bit about your plan, the district's plan, and how that may be able to support some of the other smaller districts in the state as they work to combat the challenge of this opioid?
Sure. Our plan is pretty extensive. So on September 22nd of this year, we at LAUSD announced that every K through 12 school in our district by mid-October would have Narcan, which is the antidote to fentanyl overdose. We would have Narcan available in all of our schools. We also announced a fourfold response, right? So Narcan is kind of the last step. There are still many steps of prevention that need to be involved. So one is the availability of Narcan at all of our schools. Second, we are implementing and expanding our peer-to-peer counseling, where we have worked with a partner to have our 11th and 12th graders talk to the younger 9th graders about health issues. We are also expanding our district education campaign called Make a Choice, where we talk about how everyday choices can lead to resilience and can be the difference between life or death. And then we are also expanding our education to families through our Family Academy. And finally, we are having a targeted safety response where our LA School Police Chief is coordinating with other law enforcement agencies and community-based partners to develop a task force to look at what's going on in the communities around our schools. So it's a very, very extensive response that I think can be followed by many other districts throughout the nation, especially having Narcan available in all of our schools. Our Department of Public Health has been so helpful in working with us with the education aspect and providing us doses of Narcan.
Robin, first of all, thank you for being here. And also thank you. I know we've had you do double, maybe triple duty, making the rounds there with our members, but I think it's a sign of not only the issue we have at hand, but I think there is an eagerness from our educators to get more information on this. I believe last week at the same time as we were probably on here, I think CDPH had a webinar on this topic, on rainbow fentanyl. What were some of the data points, some of the key takeaways? What were the overall themes and messages there that you folks were trying to get across on this issue?
Yeah, so honestly, it's similar to what Dr. Maholtra just mentioned. What we have been tracking here in the state is similar to the national trends. We are noticing an overall increase in overdose, both fatal and non-fatal, among the ages of 10 to 19. So, for example, non-fatal overdose, we saw emergency department visits more than tripled from 379 in the year 2018 to 1,222 in 2020. We know that the overdose death rates have continued to increase even into 2021. However, those data are still preliminary. Opioid overdose related deaths have increased by over 407% over the same 2 years. And that increase is driven largely by fentanyl. By 2020, over 95% of the opioid-related overdose deaths among the ages of 10 to 19 in California involved fentanyl. So to put this in context, we see this across the nation. More and more opioid overdose deaths are involving fentanyl. But what the data are really starting to tell us is that the rates of increase, they're increasing faster among the adolescent population. And that's concerning to us.
Folks, want to remind you, if you have any questions for our two guests today, go ahead and put those into the chat, and we'll make sure we tackle those at the end of our discussion. I do want to make note here, Jennifer Earl Foss from Region 15 in Glendale Unified makes note that they've received their Narcan and training in Glendale Unified. So that's a step forward there. I'm going to ask both of you, but Robin, I'll start with you. Let me just give a couple of data points here. This is coming from a news release last week from the United States Drug Enforcement Agency, the DEA, indicating that rainbow fentanyl has now been seized in 21 states. Fentanyl remains the deadliest drug threat facing this nation. In 2021, a record number of Americans, 107,622, died from a drug poisoning or overdose, and 66% of those are associated with a synthetic opioid like fentanyl. Robin, let me just ask you, and then Dr. Maholtra, I'll have you respond as well. From your perspective, what is the next move for our education leaders?
Yeah, I mean, I see this as like a 3-step process, right? So harm reduction approaches such as naloxone on school campuses, they can save lives. They have an immediate life-saving effect. So first, take a look at your school policies and look at other school policies, such as those at LA Unified, just to see what might work for you and your district in terms of expanding access to naloxone on campus. And once you've resolved that, contact CDPH, seek out a CDPH standing order. This permits entities to distribute naloxone without a prescription to any individual who may be at risk of an overdose or in a position to help. And then finally, try to find resources within your community. And we often refer people to DHCS, or the Department of Healthcare Services Naloxone Distribution Program, in order to obtain free or low-cost naloxone. And Dr. Maholtra has mentioned she's reached out to her local public health. There's also community-based organizations that may be in a position to help.
Dr. Maholtra, what would you say next move for education leaders?
I definitely agree with everything Robin just said. First of all, providing Narcan in schools is so important, so necessary. I'm happy to be a resource for any other districts that need help and guidance how to obtain Narcan. Our community-based organizations have been so helpful with that as well. So I'm really proud what we're doing at LA Unified. But again, providing Narcan, right, is so important. It's a reactionary response. By the time we're giving Narcan, we have missed many opportunities that have brought us to this point. Underlying this crisis is a deeper and much more urgent mental health crisis. Why are youth turning to these pills in the first place? What we have seen in our district is there are areas that are harder hit than others. So what we have been doing is really trying to understand, what are the issues that our students in these areas that are harder hit by these drugs, what are they facing? Are they living in crowded homes where they don't have any privacy? So they find themselves spending a lot of time outside. And what's outside of the home for them? No safe parks, no safe spaces. What can we do as a school community to provide safe spaces for them? What can we do to provide consistent, reliable, nurturing adults in their lives or help them feel like they belong? So really, schools really need to look at the mental health and social supports that can be provided by a school district, because ultimately this sense of safety and belonging is what our children need, and that's where the real and heavy work lies.
Robin, as we wind down, and I know you touched on this, but I'm going to ask you to just rephrase it. If somebody tuned in late or just, was okay, this was an eye opener for them. It's like, okay, my school maybe needs to do some movement here. I think it was Blaine who asked, can you share with us, how can we obtain Narcan? How can we get the training? Where's the first person? Where's the first place you would send folks who maybe haven't taken those steps yet?
I will drop the link in the chat. I would recommend you Google. You can look this up on your favorite search engine, the CDPH statewide standing order. It provides you with information on how to distribute naloxone. It provides you with training in how to administer naloxone. And there's information on how to connect with DHCS's Naloxone Distribution Project, which is just one resource in order to obtain free naloxone for your schools.
All right, Robin Christensen from the California Department of Public Health, Dr. Smita Maholtra, Medical Director at LA Unified. To both of you, thank you so much for being with us today. We look forward to having you on again.
Thank you for having us.
Thank you.
Want to let all of you know, I know we were referring to a couple of things resource-wise on Rainbow Fentanyl. Right now on the AXA Resource Hub, we've put a number of resources from the state, from the federal government, and from school districts here in California. Information they're pushing out and information you need to know. You can access that information on the Resource Hub, content.axa.org. I know we had mentioned during the show last week, CDPH was doing a presentation, a webinar on rainbow fentanyl. We have taken the slides from that presentation, put that on the hub. So you can go ahead and access that as well. And I see that Maria Thompson asked a couple of questions here. Maria, there is some content, as I mentioned, over on the AXA Resource Hub. So I would encourage you to go ahead and see
know
that.
Just because we had a similar conversation and some of these questions that Maria and others had been asking, for those folks directing the appropriate staff in the district to check out that webinar, to check out those slides. I know Robin and the team at the state have made themselves very available to just walk people through the process on liability issues, the nuts and bolts there. And since we referenced Maria, let me just give her a quick shout out, because this is the beauty, not just about this mechanism, but we're only as good as our members talking to us, right? Like, we've seen the headlines, whatnot. I know Maria a couple of weeks ago sent me a note, hey, this is an emerging issue. Even before all the headlines were coming out, like, AXA may want to talk a little bit about this. So I would just invite folks, not just our viewers, just our members, if there's something that's not on the radar, if there's something that we're not talking about, really push us to get some of these resources, get some of these connections in front of our members. So just thank you to Maria and others who highlighted this one for us some time ago.
Yep, totally agree with you. Folks, want to promote something real quick. AXA Leadership Summit coming up first week of November in San Diego. More than 900 California school leaders have already registered for this event. If you haven't registered, you may miss out. Here's a preview. That is right. 2022 AXA Leadership Summit in San Diego, November 3rd through 5th. You can get more information and registration at axa.org right there on the homepage. I'll be handing out AXA Legislative Lunch Break swag there. And Edgar, you'll be signing one of these photos, correct? I think it should be this one right here.
Hey, you tell me where to go, give me a Sharpie.
We'll find a spot for you. You can be right next to one of the keynote speakers when they're signing their book. Yes. We'll see who has the longer line.
But I see, Maria and others. Hey, great program. We're really excited to get into the swing here with our professional development opportunities, one of our biggest of the year. If San Diego's not a selling point in itself, just a great program that we'll have together for our members. Looking forward to seeing a lot of our friends down there in San Diego in a few weeks.
Yeah, and Maria put in there, we need to raffle a signed copy of it. I think that's a great idea. Folks, we are not on next week. Edgar and I will be in Burbank for our governance meetings. So hello, Burbank, and all of our members down there in Southern California. But we will be back the following week. Full show for you. Edgar, let me just ask real quick, and I know perhaps a loaded question here on this one, but I figured I'd ask based solely on the conversation that we just had about rainbow fentanyl. What do you think the likelihood is that when we swing into the next legislative session, when our state elected leaders start putting together bills to move through the process, what do you think the odds are that we may hear something about opioids here in the state of California and some possible legislation?
Yeah, I don't say this is a negative thing. I mean, I say it's a practical reality. I think the legislature and the policymakers are naturally reactive, right? Things that come out in the headlines, things that they're hearing maybe from their constituents, and that's not necessarily a bad thing. What I would charge our members with, and maybe to think about, is what are the gaps? What are the things that we need? This is a scary topic, right? As both of us as parents, our folks who are working in the trenches there, amongst all of the other issues they have on their hands, now this pops up. I would say, let's think about what are the things that we need from the state? What are the resources? Where are the gaps that, whether it's resources in terms of money, or it's making it more streamlined to access some of these mitigation efforts. I think that's the conversation we should be having, and AXA is obviously there to help facilitate some of that.
Yeah, certainly a lot of work to do. Thank you, folks, so much for joining us here on the AXA Legislative Lunch Break. Edgar and I are live and interactive Wednesdays here at 1 p.m. We will see you in 2 weeks here on the next edition of the Lunch Break. Have a great rest of the day and rest of the week, and we'll see you next time.